this computer. Okay, perfect. Now we are taping. Okay. So this session is going to be the last one, which is our live with how to live with endometriosis. One of the things I talked about in the first session or earlier before I got started, and I forgot to tape this session, which I'm taping now, is that after this session, you're going to be receiving an email towards the end of the week after everybody has a chance to watch the presentation with the endometriosis knowledge test, as well as the quality of life survey again. And then when you send them back, don't reply all to the group email, but send them back like individually, because I had a lot of digging to do when people send it back like via the reply all. So if you can just like reply back to me with your surveys, that would be great. Okay.
Gotcha. Yep.
So with this session, we are going to talk about how to live with endometriosis. Okay, so now my screen aren't. There we go. Okay. So we're going to talk today about all of these lifestyle modifications that you can make that can impact your life living with endometriosis. And as we all know, endometriosis can rule your life, but by focusing on some of these simple things, you can impact your quality of life positively. And a lot of people think that, this stuff won't work, why bother? I've tried it before, but for how long, and how long did you really stick with it? As with endometriosis, this is a lifelong journey, and trying something for one day isn't going to be helpful. You have to incorporate one, two, or all of these things to help you achieve a better quality of life. So in the next few slides, we're going to focus on each of these topics. So we're first going to talk about dietary modification and how this can impact your endometriosis pain and improve it. So dietary modification plays a massive role in the pain that endometriosis can cause. First, dietary fat influences your body's production of prostaglandins, which are chemicals that stimulate uterine contraction and can affect ovarian functioning. Secondly, a high level of prostaglandins can lead to higher production of estrogen, which can influence the growth of endometriosis lesions. So the more fat you have in your diet, the more estrogen your body can produce. And so eating foods that stimulate and cause inflammation fuel the fire and can cause those unexpected flares of pain that you all feel. I always tell patients when making dietary modifications that most of the time you could pick probably the 3 most common food triggers that cause your pain flares. If not, you should do a weekly food diary and track when you don't feel well, or when you have changes in your bowel or bladder habits, or when you have pain flares. And by doing a journal, you're likely going to be able to follow the things that trigger flares and plan how to eliminate those foods from your diet, which can then improve your pain. And I always advise patients to focus on dietary modifications on the white things in their diet. White things like white rice, white pasta, white flour, white bread, dairy, fatty foods, etc. Unfortunately, oftentimes those are the comfort foods that we go to when we aren't feeling well, like pizza or ice cream. And you all know the ones that I'm talking about. And because endometriosis is a disease of inflammation, eliminating foods that cause inflammation will go a long way to improve your quality of life and your pain. So exercise routinely can improve endometriosis symptoms. I know that when having one of your pain flares, exercise is typically probably the last thing on your mind, as most people struggle to even get out of bed when you're in pain. But regular exercise can improve symptoms. When you exercise, your brain releases feel-good chemicals called endorphins. And these are naturally occurring hormones that work like pain medication and pain relievers to lower pain. It takes about 10 minutes of exercise that makes you sweat or breathe harder or increase your heart rate for your body to begin making these types of chemicals and experience pain relief. Regular exercise also helps our bodies circulate much needed oxygenated blood to our organs, not to mention those nutrients we learned about in the previous slides. Regular exercise can also lower the estrogen in your body, which can lessen your endometriosis pain and improve your endometriosis symptoms. Exercising routinely can also improve your physical health, not to mention your mental health. And those endorphins we talked about can also boost your mood. We all know how debilitating this endometriosis journey can be to your mental health, and many endometriosis patients also struggle with anxiety and depression from dealing with a chronic disease, not to mention the struggle most of you had in getting a diagnosis, being told that all of the symptoms were in your head and making up the severity of your pain. Exercise can also improve the strength of your pelvic floor. Due to the pain and chronicity of disease, many people have scar tissue, pelvic adhesions, not to mention the stress of the ligaments and muscles around your uterus, your ovaries, your bladder, and your colon. Therefore, regular exercise and pelvic floor physical therapy exercises can really be beneficial. Choosing to do things to improve your overall health and quality of life and well-being, like exercising, can go a long way to helping you feel better in the long term. Remember, it's a marathon, not a sprint. So improving bowel health is probably one of the most important things you can do to help your endometriosis and your flares of pain. Women with endometriosis are known to complain of severe abdominal pain, constipation, diarrhea, irritable bowel disease, bloating, gas, nausea, vomiting, and extreme pain with defecation. Pain with bowel function often comes with the severity of disease or pelvic adhesions from long-term endometriosis or stage 4 frozen pelvis. Therefore, the importance of making sure you have regular bowel movements is critical to limiting pain and flares of disease. Endometriosis lesions can cause inflammatory activity and local prostaglandin release, which can alter bowel function. Endometriosis lesions in the bowel can also cause pain from obstruction. In addition, specific treatment forms for endometriosis and medications like the GnRH analogs that we talked about in previous lectures can alter bowel motility. And controlling inflammation in the pelvis is critical to preventing flares of pain. When your colon is distended with large amounts of stool, it is inflamed. And so when one thing in your pelvis gets inflamed, other things in your pelvis gets inflamed. And I always say everything doesn't play nicely in the sandbox together. That visceral hypersensitivity, or the viscera, is like the pelvic peritoneum on the inside, caused by inflammation, can cause bowel complaints and mast cell activation, which is induced by immunological responses, autoimmune triggers, and things like that, which can trigger pain. Ways to improve your bowel health would be to ensure that you're drinking enough water, staying well hydrated. Magnesium supplements can help draw fluid into the intestines and help soften stool, relieving constipation. And probiotics can repair the damage done by inflammation and provide healthy gut bacteria. And friendly gut bacteria can be killed off by antibiotics, stress, and poor diet. So can you see how these topics all work together? One of the most interesting facts that I found preparing these slides was that it is estimated that the harmful bacteria in your colon can weigh up to 3 to 5 pounds, which often contribute to the pain, bloating, and endobelly that you all suffer from. Gut health can work congruently with your immune system to help it grow and develop and be ready to fight infections or other ailments. Proper positioning while defecating can also aid in bowel function as well. Squatting with your feet and knees elevated can allow the puborectalis muscle to relax and improve bowel elimination. So think about that squatty potty that's been advertised. Bladder health and pain can also impact women with endometriosis. This can also be a reason for the delay in diagnosis, as many patients have been given or may have been given an inaccurate diagnosis of painful bladder syndrome, what used to be called interstitial cystitis, when they in fact may have endometriosis. In fact, also women who have endometriosis, 60% may also have painful bladder syndrome, and it's called endo's evil twin. You may also hear about endometriosis's evil triplet, which is irritable bowel disease. So you'll see all three of them mentioned as causes of pelvic floor inflammation. There's only about 1% of women affected with endometriosis that have endometriosis that affects their urinary tract. But of that 1%, there's 70 to 75% of women that have bladder endometriosis. And symptoms of bladder endo may include painful urination, which is also known as dysuria, blood in the urine, which is known as hematuria, bladder pain, urgency, frequency, low back pain, which often worsens with menstruation. There are some women with bladder endometriosis don't have any symptoms, but those that do have symptoms and do have endometriosis on the bladder, excisional surgery is critical for improving symptoms. And afterward, it's really important to retrain the bladder to empty normally with timed voiding, whether or not you have to go to the bathroom or not. Train your bladder to empty every 2 hours so it can improve on urinary frequency and urgency symptoms. Dietary modifications and lifestyle changes, controlling inflammation, can also be helped by avoiding citrus and acidic foods, limiting alcohol, caffeine, and pelvic floor physical therapy is also something that helps control symptoms positively to manage disease. So essential oils can be used as a natural treatment choice to reduce pain, inflammation, hormonal imbalances, and other negative impacts of endometriosis. These essential oils are potent liquid extracts from the aromatic parts of the plant. So you see the mint leaves there. So the leaves are the part of the plant that contain the oils. Um, Essential oils can contain numerous medicinal chemical constituents that give them their therapeutic properties and can be a natural remedy for many ailments, not just endometriosis. Common endometriosis complaints that essential oils can target are inflammation, pain, menstrual dysfunction, hormonal imbalances, and other mental health complaints like anxiety, depression, and stress. Some of the most helpful essential oils for endometriosis can be lavender, which can be used to improve menstrual cramps, relieve stress, promote sleep, and calm anxiety. It is often most helpful when it's massaged on the abdomen when it's infused or mixed with 15 to 20 drops of the oil with 2 cups of Epsom salts and added to a warm bath. Clary sage is one of the ones that most patients I have met have used, and it can work for many menstrual-related issues due to its hormonal balancing properties and also due to the natural phytoestrogen that it contains. In addition, when it's used in massage, research has shown that clary sage can reduce menstrual cramping and reduce areas of pelvic obstruction. Rose geranium is also suitable for hormonal balancing and can solve breast tenderness issues and is an effective uterine tonic while improving anxiety and depression. You can mix 3 drops of geranium oil with 3 drops of clary sage in 2 teaspoons of coconut oil and can be massaged in the abdomen twice daily, can be very helpful. Marjoram is a patent bone reliever with antispasmodic properties so that can relieve some of the IBS and painful bladder syndrome symptoms, relieving cramping and pelvic floor spasms. It also can have a warming effect that assists with inflammation and improving circulation. Chamomile can also have calming properties, and when diffused, it can improve feelings of sadness, depression, anxiety, and hopelessness. It is also a natural analgesic property, assisting with pain and can be massaged or used in a bath. Peppermint oil is an oil containing menthol, which is a powerful compound that can be used to numb pain. It can also be very beneficial for headaches, migraines, menstrual cramping, and low-grade fevers. In addition to 3 drops and 1 teaspoon of coconut oil can be used in massaging your lower pelvis or in a warm compress or hot water bottle that can aid in its ability to create relief. Peppermint oil is really, really good for headaches. I had a patient once give me a little vial and you rub it right behind your ear here, directly behind your ear, and it works like a champ. It really does work really well. And you don't need to use a lot of it, just a little behind your ear. And any of those oils can be used for massage, diffusion, or in a bath. So one of the things I think is probably one of the most impactful things to talk about is mindfulness. And so mindfulness is being present and acknowledging your thoughts, feelings, and sensations at the moment they're happening without judgment or analysis. So mindfulness is thought to be a process that requires you to be completely silent, emptying your brain of all its thoughts. But it's also believed for someone to practice mindfulness that you need to involve meditation. But mindfulness is instead a process of accepting your condition and letting go. It can be incorporated into our actions, being mindful when we walk, feeling your feet touch the floor, how your feet may feel in your shoes, observing what you hear around you. Mindfulness is really requiring you to stay present at the moment and pay attention to what you're doing. And so with endometriosis, many feel depressed and anxious due to the severity of your disease. So practicing mindfulness can allow you to become more aware of your negative thought processes and patterns and not allow them to have the power over you that they once did. And so by being mindful, you can move away and take a step back from the negativism and see those thoughts were not your actual reality. Um, Research has shown that patients with endometriosis that have practiced mindfulness have reduced their risk of depression. It also shows that the part of your brain that feeds your fight or flight response decreases in size when you practice mindfulness. And it has also reduced rates of anxiety and can also reduce that brain fog that many of you experience. Mindfulness can also assist you in thinking more clearly and has resulted in increased gray matter density in the brain, which is responsible for functions such as problem solving and planning, and also an increase in the thickness of the hippocampus, which is responsible for learning and memory. So, most importantly, mindfulness can change your relationship that you have with pain. So, while it takes practice and time, by being present in your pain and truly understanding and listening to it, it can help you soothe your brain's underlying pain patterns, allowing new habits to take hold and alter your brain's structure and function, allowing you not to feel the pain with the same intensity that you once did. It's easy to become angry and resentful of your endometriosis diagnosis and journey. However, mindfulness can reframe your mindset, setting you on a more positive path forward in the future. So stress management is really something that can directly impact your physical health, and mental health we know is always something that plays a direct impact on your physical health as well. Stress can impact your immune system and make you more susceptible to ailments. There was a study that was performed in 2018 where rats were afflicted with endometriosis and showed that when they were placed in situations of stress, they ended up with worsening of endometriosis lesions. So I'm sure all of you can say that when you are in stressed or in challenging situations, your endometriosis flares worsen and become harder to manage. When you are in situations of stress, your bodies produce a substance called cortisol. However, too much cortisol can impact your immune system's ability to function normally, alter your response to inflammation. Stress itself can also cause increased inflammation, which we all know can cause your endometriosis and flares to worsen, leading to more pain. Stress can also encourage the growth of nerve fibers, sending increased pain messages to your brain. So life we know comes at you with all kinds of stressors. There's work stress, there's life stress, there's relationship stress, there's intimacy stress with a partner due to pain. So instead of trying to eliminate stress, developing healthier ways to cope with stress, such as the mindfulness we just learned about, meditation, journaling, yoga, personal therapy or a counselor, surrounding yourself with a strong support system that can lift you up when you're down or in a flare can really improve your coping mechanisms the next time that you're having a flare or having pain. So finally, good sleep hygiene and sleep health are incredibly restorative to your soul, to your mind, and your body. But sleep's effect on the management of endometriosis has been controversial. We know that sleep is an essential physiological process that can be impressed by many physiological disorders, and sleep has been shown to be disrupted in many endometriosis patients. Sleep quality in women with endo is associated with a poorer quality of life and depression and is often disrupted by the symptoms of endometriosis that we previously had discussed. In addition, inadequate sleep can also affect your pain threshold. And again, that then affects your ability to tolerate pain, increases pain, and can affect sleep. Cortisol, which we already learned is affected by stress, can also inhibit melatonin, which is a natural substance in your body which helps you fall and stay asleep. Many other lifestyle modifications previously discussed, such as diet, exercise, improvements in bowel and bladder health, and stress management, can also lead to improved sleep quality in patients as well. Establishing a sleep routine can adjust the body into a natural sleep pattern using breathing exercises, meditation, warm bath, really unplugging from all of your electronics, turning your phone off. Don't scroll through Facebook and Instagram and all that stuff before going to bed can help promote a healthier sleep quality as well. Keeping your room dark and calm and comfortable, like, helps you have a more restorative sleep as well. And sleep is really essential for daily repair and energy. And prioritizing sleep can really aid in the improvement of your endometriosis. So that concludes our education session for today. That is my contact information, phone number for the office. Thank you so much for participating in these educational sessions and for helping me complete my DNP project. It really is my hope that you've learned something about your endometriosis you didn't know before and that can help you with your endometriosis journey. I hope these education sessions can empower you to be ambassadors to your fellow endometriosis sisters and warriors and improve their health journeys as well. As I said, after watching this session towards the end of the week, you're going to get another email from me with the endometriosis knowledge test and the quality of life survey again. I'd like to receive them back as promptly as possible just so I can finish up with my data analysis. One of the things we talked about at the end of the last session was how important patients have found pelvic floor physical therapy in managing their symptoms. One of the other tips and pearls of pelvic floor physical therapy somebody shared that I want to make sure I share with people that are watching this is that one patient was having a lot of trouble with constipation. And the pelvic floor physical therapist said to mix 1 cup of oat bran, 1 cup of applesauce with 3/4 of a cup of prune juice and take 2 tablespoons of that with 8 ounces of water in the evening between 4 and 7 o'clock. And the patient, one of the participants here in the project had said that that was extremely helpful. So I wanted to make sure I shared that on this platform because I forgot to record it the first time. So I'm recording again. One of the other things I'm just going to share if people, I had a good question about like what got me to doing this. And so I wanted to kind of re-share my story so people could hear this that weren't watching before. I started working at Hershey Medical Center in 2006 and was the nurse care coordinator. And that's when I first met Dr. Harkins. And so by working with Dr. Harkins, taking care of his patients on the floor, I started taking care of patients that had surgery for endometriosis. And so at the time back then, patients would stay overnight and I got to learn about endometriosis. I really hadn't had any exposure to it before, but I loved taking care of endometriosis patients and I loved working with Dr. Harkins. And so when I went back to school for my nurse practitioner degree in 2009, this job that I have now was the one that I always wanted. But when I finished with school, there wasn't a position with Dr. Harkins. So I worked in family practice for 2 years. And then one November day, I got to work at 7:30 and opened my email, and there was an email from Dr. Harkins that said, Pam, your job's open if you want it. And at the time, I was shocked and couldn't believe it because I was working in a family practice in Harrisburg that was for underserved population that I really loved. I was taking care of a lot of women and I was taking care of a lot of kids, and I really liked my job, but I knew this was the job I always wanted. So I was going through a divorce at the time and said, hey, we need to chat. There's some life things that have changed since I met you last. And so that's the end of that. And I've been with him ever since. So anyway, so that is my story. I am going to stop recording, but thank you again for helping me with my project. I will be sharing all the links to each of these recorded sessions when I send out your email and your surveys. So if anybody wants to watch them again and have them for reference, I will include them in the email because people had asked also to get the links to all the recorded sessions. So I'll attach all of those to the email when I send your surveys. So let me stop recording.